I want to solve all my dental problems, but I'm so afraid of the rubber dam.
Many patients are afraid of the rubber dam because they don't have enough information. There is nothing to be scared about. Rubber dam is just a protection that we dentists are using to isolate the teeth that require treatment.
But how is rubber dam protecting me?
You should know that first of all, rubber dam is one of the most important tools that the dentist is using to prevent the airborne contamination in the dental office. In almost all restorative procedures, rubber dam is acting like a barrier, blocking saliva or bleeding from the gums to interfere in the working area, hence significantly reducing the formation of contaminated aerosols.
But how is rubber dam attached on my mouth?
Basically, the rubber sheet is attached to a frame and only few teeth undergoing treatment are exposed through some tiny holes. Some small clamps are attached to the teeth to keep the rubber sheet in place.
That must be really painful.
Actually, you will not feel anything because anesthesia will be given for the dental procedure anyway.
Okay, but how can I breathe with this thing on my face?
You will not have any problem breathing because the rubber sheet is not blocking your nose. Also, the rubber sheet is not hermetically sealing your lips, so you can also breathe from your mouth.
What if I'm a little bit claustrophobic?
Claustrophobic patients deserve the same quality treatment like all the others. Of course, a different approach is required, like for example, sedation, so the patient can overcome this challenge.
Also, I'm a little allergic to latex.
Latex-free rubber sheets are available in this scenario and also latex-free gloves for the dentist and the assistant.
Why do you say that the treatment with the rubber dam is a high-quality treatment?
Imagine that the dentist is working on a small object, a tooth that is only 6 to 10 millimeters, and he has to perform meticulous and exact procedures. In order to do that, he needs proper conditions. For example, rubber dam will provide for the dentist a wide and comfortable working area by retracting the cheeks, tongue, lips and the gums. This is the only way to properly expose the entire tooth surface and even deep margins which might be covered by the gum. So the dentist can actually see what he's doing, especially that more light will be reflected by the rubber sheet on the working area. All the fillings, root canal treatments, cementation of crowns or veneers, and many other restorative procedures are done under isolation with rubber dam without being in contact with saliva. The results are more likely to last longer if performed in these conditions.
Okay, I mean these are dentist advantages, but what are my advantages as a patient?
Imagine that all this grinded material resulted when removing the old fillings or even cleaning the cavities will be blocked by the rubber sheet and will not go in your mouth or in your throat. Basically, the working area is isolated and separated from the rest of the mouth, and underneath this rubber sheet is just your normal saliva, and the assistant can easily retract a little bit the rubber sheet and use the small suction anytime is necessary. And you will not experience the annoying sensation of dry mouth, which is very common when working without rubber dam and using the continuous suction. Also, your mouth will not be filled with cotton rolls that are extremely unpleasant, especially for patients with gag reflex. But overall, the main advantage for the patient, especially nowadays, is the fact that the rubber dam is significantly reducing the risk of airborne contamination in the dental office.